mining health, mining safety. Ranking Member Braun and I will each give an opening statement, then we'll introduce the witnesses. After the witnesses give their testimony, the senators will have 5 minutes for a round of questions. For a long time, we've relied on our miners to help us keep the lights on. And we owe it to them to make sure that they have a safe and healthy workplace. And that's why we're here today, to talk about what's needed to best protect our miners, both today and in the future. For generations, we've relied on resources like coal, uranium, copper, to fuel our economy, to run electrical generators, to support infrastructure and power not just manufacturing, but all aspects of our society. We know that the work to extract these resources can be dangerous without good and consistent safety measures in place. Thousands of miners have contracted and died from preventable diseases like black lung and silicosis. Our miners deserve safety and protection in their workforce, in their workplace, just like any other job. Our country, I think, is at the cusp of I call it a great transition. We're gearing up for a clean energy economy to help secure energy independence and to address climate change in a pragmatic and real way. As we make this new transition, I think it's an exciting time. We have to make sure that miners are not left behind. These workers are going to be as important, probably more important than they ever have been. We're going to need critical minerals like cobalt and graphite to build electric vehicles, to build wind turbines, and to support nuclear power. But we're going to have to work and fast. For some of these minerals, we currently don't have close to enough for what we anticipate we'll need. For others, our processing options are too long, our supply chains are too concentrated, really. We need to strike the right balance to procure these important resources responsibly and protect both our communities and our workers. That means ensuring health and safety standards and supporting new mining safety technologies. And we need to build trust and strengthen workforce pipelines for the mining industry altogether. Now, we can do this by taking steps to proactively protect our miners and making sure that the mines that we create are safer than they've ever been. And these actions should look like mitigating exposure to the irritants that cause preventable mining illnesses like black lung and silicosis. What start out as irritants over a period of year lead to these insidious diseases. We need to make sure that federal benefits like those available under the Black Lung Benefits Program and the Radiation Exposure Compensation Act are available to the workers who need them. And we should be exploring how we can make sure that workplace safety resources like real-time dust sampling technologies are accessible to workers and employers around the country. I appreciate Ranking Member Braun for working with us to host this hearing. I also want to thank Senators Kaine and Casey for their collaboration on this issue that they both have worked on so hard and both know so well. In many cases, their constituents have been side by side with them. With that, I'll recognize Ranking Member Braun for his opening statement and to introduce our first witness.
Thank you, Mr. Chairman, and the witnesses here today. With today's hearing, we are looking at a profession that is tremendously beneficial to our society, but one that is not without risks and hazards for those who work in and around it. My home state of Indiana is one of the top coal-producing states in the country. Understand the importance of ensuring working conditions for American miners that are safe and as healthy as they can be. In the past, I've been proud to champion mining legislation that became law with Senator Casey, the STREAM Act, which addressed the safety and environmental hazards of abandoned mine lands. This bill made it easier for states to maintain treatment systems for the release of highly acidic water from abandoned mines, which pose a threat to those that work and live around those areas. Black lung disease also poses a significant threat to those in the mining industry. In '69, Congress passed legislation to provide compensation for miners suffering from black lung disease and later established the Black Lung Disability Trust Fund. This fund pays out benefits to coal workers and their families in the unfortunate cases when they become afflicted with the disease. In Indiana, there were nearly 19,000 black lung compensation claims filed in fiscal year 23. And that number is significantly higher in places like Kentucky and West Virginia. It is important that this fund remain financially stable to provide for affected miners and their families. In the past, this fund has been grossly mismanaged, where its total liabilities exceeded its assets by billions of dollars. It's no good. It's not going to be there for the people that needed it. Following recommendations from the GAO, past administrations have taken concrete steps to enhance oversight and improve the trust fund's financial position. Unfortunately, those efforts have run into hurdles in recent years. This is simply unacceptable, and vigorous oversight from Congress is needed to ensure that this fund is properly administered and remains solvent in the long run. I look forward to hearing the perspective of our witnesses and giving these issues that are critically important for miners and the coal industry the attention they deserve with this hearing. Move to witness introduction. I'll start, or do you?
Please begin.
I'd like to introduce Mrs. Cindy Brown Barnes, who serves as Director of the Government Accountability Office's Education, Workforce, and Income Security Team. Mrs. Brown Barnes has over 30 years of service performing financial, forensic, and performance audits of federal agencies and programs. We welcome her expertise to this panel. Thank you for being here. I yield back, Mr. Chairman.
And now I have great pleasure in turning it over to Senator Kaine to introduce our next witness, Dr. Drew Harris.
Thank you, Mr. Chair and Ranking Member Braun, and it's great to welcome all the witnesses. Even though I'm not charged with introducing Cecil Roberts, I just have to say that there is not a better labor leader in this country, not only today, but during the history of the labor movement than my friend Cecil Roberts, and I'm so glad you're here with us. Now, my job is to introduce a great Virginian, Drew Harris. Dr. Drew Harris is the medical director of the Black Lung Program at Stone Mountain Health Services, which is a federally qualified health center in Southwest Virginia. It's the only FQHC that has a black lung clinic in the Commonwealth of Virginia, and it's the largest in the country, with about 2,000 coal miners seen there annually. As medical director, Dr. Harris provides medical and medical legal consultations and oversees the pulmonary function lab and the pulmonary rehabilitation program. Dr. Harris also serves as the associate program director in the University of Virginia's internal medicine residency program. He founded and directs the Health Equity Advocacy and Leadership Track program and coordinates community-partnered medicine programs in collaboration with community partners, including the Charlottesville Free Clinic and the Haven, which is a homeless shelter and resource center. He teaches UVA residents seminars on physician advocacy, black lung disease, rural health, and a practical approach to the social drivers of health. He's also the co-principal investigator on a research study that brings 7 black lung clinics around the country together to better understand the mental health of coal miners. He's the first editor-in-chief of a publication called Chest Advocates, focusing on practical approach to physician advocacy in the pulmonary space. I'm so grateful for the work that he does, and I'm so grateful, Dr. Harris, that you are joining us today.
Thank you. And now I will have the responsibility and the opportunity to introduce, I would say, not just one of the great leaders in organized labor, but certainly perhaps the greatest leader. How's that? I can't let him outdo me. Mr. Cecil Roberts is the president of the United Mine Workers of America, and having been a coal miner himself, President Roberts has an extensive background with the mining industry, helps the union's more than 50,000 members navigate federal and statewide mining benefits programs while advocating for health and safety reforms. He's also on top of a level of detail that most leaders don't. He's chastised me at one point when we first met about not having gotten a tour of the Ludlow site. And luckily, I was back on my toes and could quote back to him Ron Chernow's book, Titan, how the Ludlow Massacre in Colorado actually transformed the Rockefeller family from being titans and magnates worried about their business into focusing completely on creating a foundation that could make the world a better place. And it's unfortunate it takes sometimes a tragedy to create that, act as that kind of a catalyst. And then I also have the great, I won't be able to put on quite the superlatives just because I haven't been challenged by another senator. But we are very grateful to have Dr. Steve Shafrick here. He's the Associate Professor and Director of Graduate Studies in the Mining Engineering Department at the University of Kentucky, one of the great schools around mining technology and mining education in the country. There he leads research about mining technologies, including mine automation, ventilation, and mine dust filtering, obviously which all have an efficiency aspect but a real bearing on the health of the miners. So anyway, why don't we go down and start with Ms. Barnes, and you can give your opening testimony, and we'll go down in order.
Chairman Hickenlooper, Ranking Member Braun, and members of the subcommittee. I'm pleased to be here today to discuss, 1, the serious financial challenges facing the Black Lung Disability Trust Fund, 2, GAO's prior recommendations concerning the Department of Labor's limited oversight of coal mine operators' self-insurance, and 3, updated actions that the department has taken to improve oversight of self-insurance and implement our recommendations. My testimony is based primarily on GAO reports from 2018 through 2021. The Black Lung Benefits Program provides cash and medical assistance to coal miners who are disabled due to black lung disease. Over 23,000 beneficiaries received benefits during fiscal year 2023. Black lung benefits are generally paid by liable coal mine operators. Operators may purchase commercial insurance or self-insure to cover the benefits. The federal government's Black Lung Disability Trust Fund pays benefits when no responsible mine operator can be identified or the liable mine operator doesn't pay, such as in the case of a bankruptcy. A domestic coal tax is the trust's primary source of revenue. This brings me to my 3 discussion points. First, the trust fund has serious financial challenges, with expenditures consistently exceeding revenue, especially its debt and interest repayments. Consequently, the trust has borrowed from the Treasury almost every year since 1979. In fiscal year 2023, the trust fund had to borrow $2.7 billion to cover its expenses, and based on the Department of Labor's projection, the trust debt could exceed $13 billion by 2050. Compounding these challenges, coal operator bankruptcies have further strained the trust fund. We previously reported that bankruptcies between 2014 and 2016 of self-insured operators led to the transfer of $865 million in benefit responsibility to the trust. Since then, at least 5 more self-insured operators have filed for bankruptcy. Making things worse, there has been an increased occurrence in the number of miners contracting the most severe form of black lung, likely leading to increased future liabilities. Now on to my second point. In response to the department's limited oversight of coal mine operator insurance, we made 2 priority recommendations for labor to, 1, develop procedures for self-insurance renewal that clarify how long an operator is authorized to self-insure, as well as when the self-insurance authority would not be renewed. And 2, that they develop procedures for self-insured operator appeals. Both of these recommendations remain open. Now for my third point. When we testified in February 2020, we noted that the Department of Labor had begun implementing a new process for self-insurance that, if implemented effectively, might have helped address past deficiencies and our recommendations. That didn't happen. DOL said their ability to resolve appeals was hindered by the COVID-19 pandemic as they and the coal operators adjusted to different working conditions and also experienced challenges in processing documentation. As a result, the department suspended its reviews of operator appeals. However, in January 2023, the department issued a notice of proposed rulemaking that would, among other things, require all self-insured coal mine operators to post security to cover at least 120% of their total estimated current and future liabilities. The Department of Labor is also proposing changes to the self-insurance application, the renewal, and the appeals processes. Labor submitted its final draft rule to OMB for review earlier this month. The department's rulemaking effort, once completed and if implemented effectively, may address our open recommendations. Given the dire situation facing the trust fund, we reiterate the need for the Department of Labor to complete action on this proposed rule, address our priority recommendations, and effectively oversee the program. This completes my prepared statement. I'll be happy to entertain and look forward to your questions.
Thank you. Dr. Harris?
Chairman Hickenlooper, Ranking Member Brown, Senator Casey, and Senator Kane, I appreciate the opportunity to talk today, and I'm going to start off by sharing the story of one of my patients. And Paul is 62. He's a father and a grandfather, and in his 20s, he worked for 8 years underground in a coal mine in eastern Kentucky. He worked until a roof collapsed and crushed him, and he was no longer able to work, and he became a church pastor. And about 10 years ago, he started to develop shortness of breath, and he was evaluated, diagnosed with black lung with an x-ray and pulmonary function tests at my clinic. And about 5 years ago, the symptoms progressed, and he felt difficulty occasionally even finishing his church sermons. And he applied 3 times for black lung benefits, but was denied benefits each time, despite imaging and a lung biopsy showing that his lungs were full of coal and rock dust. And Paul's story is similar to countless other miners that I care for and illustrates 3 main points that I want to illustrate today. The first is that rates of severe black lung are at near historical highs in central Appalachia. The second point is that we should be using additional existing tools to improve the early detection and diagnosis of black lung. And the third is that the black lung benefits process is frustrating for nearly all coal miners, and the Black Lung Benefits Improvement Act would be a big step in the right direction. So first, Paul is not alone, and he's in fact part of a much larger problem. Earlier this year, my colleagues and I published in JAMA, the Journal of the American Medical Association, a publication describing over 1,000 coal miners who in the last 5 years were diagnosed with progressive massive fibrosis, which is the most severe form of black lung. We're seeing a huge resurgence of severe black lung, which is an entirely preventable disease. And like Paul, many of these miners are young when they get diagnosed, and they only worked a short tenure in the mines. My second point is that better early detection of black lung is possible and key to preventing severe disease, and I have 2 suggestions for improving black lung diagnosis and detection. The first is we should be screening all miners with a special breathing test called diffusing capacity. This is cheap, widely available, and measures how well the lungs perform, and an impaired diffusing capacity can be an early warning signal for black lung. The second is that we should be utilizing CT scans for especially high-risk miners to diagnose disease. We know that CT scans are more sensitive than X-rays for early detection. Perhaps Paul's disease would have been diagnosed earlier if he were offered a CT scan or a diffusion test during his coal mining career. And if so, perhaps he could have requested a transfer to a less dusty position and may not be struggling to breathe today. My last point is that the black lung benefit system, as currently designed now, does not work for miners like Paul, and a fix is needed now. Coal miners with severe black lung fight for more than their breath. They fight for their livelihood. The federal black lung benefits program provides health insurance and a small monthly stipend to the minority of miners to prove they're sick enough to meet a disability standard, and this is almost always a long and difficult process. Paul didn't qualify for benefits until I published his story in a medical journal, which was submitted along with his 4th application. It shouldn't have taken Paul 6 years, 3 rejected claims, a lung biopsy, and a publication in The Lancet to get Paul qualified, or many other miners like Paul that should be qualified. And my patients who eventually do receive benefits are receiving a small stipend that's not even indexed to inflation. The Black Lung Benefits Improvement Act would improve this process in several ways. Importantly, it would improve accuracy in diagnosis of progressive massive fibrosis by incorporating the better imaging that we get from a CT scan in miners that have abnormal x-rays. And this act would also increase benefits by indexing the benefits to inflation. But as you all know, a version of this act has been proposed for nearly a decade and has not yet passed. And while it's too late for Paul to benefit from these proposed changes, many in his church congregation and his community could still be helped by these changes, and nationally there are many thousands of miners with devastating black lung that desperately need this help. Thank you for taking this black lung crisis seriously by having me here to speak with you today, and I hope that you'll consider the improved early detection of black lung methods that we talked about and not delay the passage of the Black Lung Benefits Improvement Act.
Thank you, Dr. Harris. Mr. Roberts.
Thank you very much. I hit talk, there it goes. Thank you very much, Chairman Hickenlooper and Ranking Member Braun and my friends, Senator Casey and Kane. I've worked for many years with these two for many years to make miners' lives better, whether it's defending their pensions and their health care or making the mine safer, and most recently, this issue of black lung. I am a coal miner. My father was a coal miner, my grandfathers were coal miners, my great-grandfathers were coal miners. Unfortunately, I never met either one of my grandfathers. Both of them were killed in the coal mines before I was born. And I had to depend on stories about their lives to know them and appreciate what they did when they were alive. And they died very young in the coal mines. But that's a story you can hear anywhere you want to hear it in the coal fields of this country. I have testified over and over and over again here, not in this room per se, but here in Congress, starting in 2003 and two other times, particularly about the black lung problem and what it does to miners and what we need to do. I want to follow up on what the doctor said here, if he doesn't mind. There are thousands of Pauls out there, and the most the most dangerous type of black lung is progressive massive fibrosis that the doctor alluded to. So we all understand something. If you contract this, you're going to die. And the average lifespan once you contract this form of black lung is 3 years. That's the average lifespan of somebody that contracts this. And this is happening in too large of numbers. And we know where it is. We know, everybody in here knows where it is. It's in eastern Kentucky, southern West Virginia, and southwestern Virginia. And we testified to this in 2019, and we pleaded with the Congress of the United States to do something about this. And recently, we did have a victory, and that was, for the first time, we promulgated a rule dealing with silica. So this form of black lung is caused by silica. So how in the world did we get in the area of the country where all these cases are originating? In young miners. We're not talking about people who spent 20 years in the coal mines. We're talking about miners who spent 3 years in the coal mines. We're talking about people in their 30s. And the news media is starting to pick up on, there's been series devoted to this problem of young people choking to death and dying because they went to work. So my position has been, and our union's position is, if we know what's causing this, and we know where it is, why do we continue on? But I want to point something out, if I might, and I don't mean to be too aggressive about this, but somebody's got to be. This is the story of this industry, and I've said repeatedly that most coal companies try to do the right thing, but we have to come to grips with some reality here. Some do not. It's like us saying everybody that drives on the road drives safely, and we know that's not true. We also know that people commit crimes. We'd be like saying we don't need the police anymore because everything is resolved. But it took 100 years, 100 years, before the first law was ever passed by the United States government that protected the working coal miner. 100 years. It was in 1969, and that wouldn't have happened had not we had an explosion in northern West Virginia that the entire nation watched on television. And then we created the Black Lung Program with that law. And we said for the first time ever, we recognized black lung as an occupational illness. We never did that before. And the truth of the matter is, this industry claimed that there's no such thing as black lung or pneumocardiosis until 1969. That's a fact. And they also said, if you make us abide by these laws you're passing, we're going to go out of business and go bankrupt. That wasn't true. And we've lived with these laws for a long time now. But now we have this. If you think it's tough to work in a coal mine, get sick. Get pneumocardiosis and try to get benefits. And here's the problem. We have rich people with lawyers saying that I'm not sick, and we have me or another coal miner trying to hire a local guy to represent me. It's not fair. It's not balanced. People are sick, they got it working, and they should be recognized for that. And they should not have to live on $700 and some while they're dying. And that's the way the program works. It's unfair. It needs to be made more fair. And that's coming from the heart of a coal miner who's seen too many people die from this.
Thank you, Mr. Roberts. Dr. Shafrick?
I'd like to thank this subcommittee of the United States Senate Committee on Health, Education, Labor, and Pensions for the opportunity to discuss important topics for miner safety. Your staff has been excellent, and I hope to continue to work together with them. My career as a researcher has been working on the difficult challenges that face the mining industry. The main goal of this work has been to create solutions that help the miner work in a safe, healthy, and productive environment. In our industry, the details matter, and every site is as varied as the Earth's crust, but I'm going to be talking in general terms. Extracting useful minerals involves breaking, moving, and/or processing tons of rock. Making a rock or anything smaller generates dust. Dust generation, characterization, monitoring, and suppression are all important topics with a wealth of information, and my written testimony discusses them in more detail than I will today. Dust monitoring in the laboratory and in the field are very different. We have excellent tools for research lab experiments, but not so many to use in the field. NIOSH's mining division has developed several technologies for monitoring and evaluation of dust, like the FAST method for silica exposure in coal mines and the CPDM, which is a real-time tool for overall dust exposure. What we lack is a real-time tool for all miners, specifically for silica exposure. It would help if it were OSHA compliant too. NIOSH has been soliciting for such a device to be developed for the last few years in anticipation of the silica rule. These projects have had mixed results, but I believe that we can get there with an effort similar to the one put forth on the communication and tracking problem. In my work, I want to get the dust out of the air. In a NIOSH-funded effort, we investigated the impingement screen on flooded bed scrubbers used in underground coal mines because the screen can be clogged, making it less effective. We have developed and field trialed a maintenance-free screen to replace it. Our field trials met airflow requirements and were well received by the workers, but had disappointing cleaning results. We're currently working with Virginia Tech and the NIOSH Pittsburgh Mining Research Division to improve the design. We've also developed a radical style of filter that is based on a filter type used in automotive spray booths and is extremely difficult to clog. This shows great results in the lab and can be used as a standalone area filter. I am working with an international manufacturer to make a prototype and trial it, most likely in South Africa. I think this kind of filter would be useful for off-Earth mining and exploration applications where dust impacts on the machines and astronauts can be easily overlooked. In this industry, if it's easy to do, it's already been done. The only way to keep up is to increase our technology, which means more engineers. The technology developed in the mines is important to many other industries, as are our products. Modern mining machines resemble robots much more than shovels. They rely on the expertise of the worker to operate safely and efficiently. We have the mineral resources, and thanks to efforts by NIOSH and SME, we also have the educational expertise. But we lack the public will to encourage highly talented engineering students to pursue a career in the mining industry. The rhetoric around the mining industry is pushing away talent. The number one question I get from parents of prospective engineering students is, will we still have mines in 5 years? It's not just parents asking that, it's executives at major technology companies too. To meet the challenges of the day, we need more engineers working together on the dust problems. Those engineers need to have a deep understanding of the processes from the mine face to the loadout and the particular needs in each place. They need to take a risk-based approach to solve this as efficiently as possible. Inefficiencies at the beginning of the production chain affect everyone in society. I thank you for your time and attention, and I'm looking forward to some questions.
Great, and thank all of you again for being here. I really do appreciate it. I'm going to be here the whole time, so Senator Kane, if you want to go ahead and start with questions. Each of us is going to take 5 minutes of questions. I'll let it run over a little bit maybe, but I'm kind of a hard ass. Anyway.
Dr. Harris, you talked about Paul. I've been struck with what Cecil Roberts said, that this is happening to younger and younger people. As I am, out in the coal fields of Southwest Virginia, meeting with miners at the compact office in Castlewood or others, I'm hearing this stories about this silica exposure getting people diagnosed with black lung earlier and earlier. Is that what you're seeing in your clinic as well?
Definitely. I think still the average age of the person who gets diagnosed with progressive massive fibrosis is older in our clinics. We're mostly seeing retired former miners. In the publication we just recently published in JAMA, I think we had 75 miners that were in their 30s or 40s, which is an outrageous number. Yeah. I mean, it's 75 people that are in the prime of their life that are getting this incurable, potentially fatal disease.
What more can we do to promote early detection?
Yeah, I think that's a great question. I alluded a little bit to what other tests we can potentially run for early detection. And I want to, if it's okay, circle back to talk about CT scans for a little bit. It gets a little bit in the weeds, but I think it's important to know that CT scans are a more sensitive test than x-rays. And so we know that through other occupations. In Australia, they've screened thousands of people that are silica exposed, and many of those folks had both x-rays and CTs. The x-rays will look normal, the CTs are not normal. And so we're missing things when we just rely on x-rays. The challenge for us is that we don't have a system like we have for x-rays already set up. So we have B readers, which are certified by NIOSH and trained to read these x-rays. We have a classification system called the ILO system for x-rays. We don't have that for CT scans in the US. Internationally, there is a system that exists for CT scans. It's just not widely utilized, and hardly anyone in the United States is probably trained on it. And so I don't think we're ready to, from a population level, start with CT scans. But I do think that since we know who's the highest risk miners, and they're folks working in Central Appalachia, they're folks working underground at the face, that we should think about using CT scans to screen the folks that are highest risk, even if we don't have the perfect tools to understand and categorize it. We can at least find the nodules. They're easy to see on CT. So that's, I think, my biggest pitch for early detection.
I really appreciate that. And now, President Roberts, in the time that I've been in the Senate, you have gone to bat again and again and again to solve tough problems. The minor retiree health care plan was on the verge of going bust in 2017, and together with Senator Casey and others, working with the UMW, your UMW members in camouflage shirts pestering us until we got it right, we got that one fixed. And then a couple years later, it was the retiree pension plan that was on the verge of collapsing. And again, with great minor advocacy here and your leadership, we got that fixed. And then the excise tax reverted back to an insufficient level that was going to leave the fund even more challenged, and we were able to work together to get that fixed. But every time you knock one down, there's another one staring you in the face. I am happy about this silica standard. I know Senator Casey and I and others really leaned hard on the administration to issue it. A standard is great if it's implemented. What advice do you have to us now that the standard is in place about what we ought to be doing as Congress to make sure that this standard gets implemented?
I was pleased to go to Pennsylvania with the Secretary of Labor and the Assistant Secretary for MSHA to announce this rule. I think the key here, it's a rule. I think it should be the law, because if we have a change in leadership at IMSHA or the Secretary of Labor, we might see this rule changed, and we'll be right back where we were before the rule was promulgated. So I would urge consideration with respect to that. If it's a good rule, it certainly should be a good law, because this is something that's going to take silica out of the atmosphere. I fully support what the medical professionals have said about silica and testing for it, okay, and black lung and testing for it. But there's nothing like eliminating the problem so you don't get sick. I hope they x-ray people and they can't find a single person in this country suffering from this disease. That's what our goal should be here in the United States Congress and in our union also. Because if you don't take the silica out of the atmosphere, I don't see how we're going to save people's lives. We might catch this early, but here's our problem. The coal industry has been shrinking. Young miners can't find jobs in any other profession. So one of the things that I would advocate for is bringing some good paying union jobs to these areas so people don't have to depend on mining. I'm a strong advocate. Let's mine as much coal as we can. I've been very open about that and provide as many jobs as possible. But one of the things that happens, a young man with children will give up his health in order to support that family. What we need to do is make that job he has in the mine safe and healthy, and also find other places of employment in these coalfield communities. Everywhere I go, I'm sorry I'm getting long-winded here, but everywhere I go, somebody tells me, we want to address just transition for you guys, but I never see it. I certainly don't see enough of it. What we need to do is find a way, in my opinion, to mine coal cleanly and safely, and people be healthy when they come home every night.
I was in Tazewell County this weekend, down near the Pocahontas area, where there have been one, massive tragedy after the next over the course of history, and I was hearing the same message from folks: mine coal safely, help us diversify and find other opportunities, and I'm so glad that you mentioned that. I yield back, Mr. Chair.
Thank you. Senator Braun.
Thank you, Mr. Chairman. I had some questions prepared that I always listen to the witnesses and try to discern what the meat of this whole conversation ought to be about. I know in my own company, many years ago, when you try to take care of your employees, and that ounce of prevention being worth a pound of cure, in this case it sounds like it would be even more than a pound of cure that you'd save. Coal mining's been around for so long. I want to ask Mr. Roberts some simple questions first and keep the answers fairly brief, because I think you can, with your experience, tell me this. Is this an issue only in underground mining, or is it an issue on strip mining above ground as well?
It's found primarily in underground mining. Just quickly, most of the easy coal, as they say back home, has been mined.
So you got to go underground.
The coal seams are shrinking, smaller. So you're mining coal in a place about the height of this table. You can't do that without taking the rock. When you start taking the rock, so you can mine this coal, that's where you get the silica.
And you get that same type of dust floating around in the air if it's above ground versus being underground. So you get it in both methods.
Well, when you do surface mining, it's been my experience, and based on the knowledge that I have, is you don't get the same amount of coal dust, nor do you get the rock silica above ground.
And then when it comes to silica versus regular coal dust, is that confined just to that triangle down in Appalachia, or do you have that elsewhere?
This would be like saying, where did the disease break out? And the disease, in this instance, is in that geographic area. You could take probably a 70-mile radius there, and you could identify where most of these cases are. It's not to say that this couldn't happen, say, in northern West Virginia or in Pennsylvania, but the likelihood of that is very remote, because they're not mining the rock as they mine the coal in those areas. They don't.
So it depends on the geology of where you're mining.
Pretty much so, yes.
Okay. And then on something as clear as silica versus coal dust, and one happening at an earlier age, it seems like just taking and focusing on where the issue is, to where it's most dramatic. What's been done by government and companies to focus on something where it's surfacing so much earlier in coal miners? What has been done?
Let me give you an example of my frustrations, if I might. I looked at my testimony. I have been doing this for years here. The first time we talked about needing to do something about black lung and mentioning silica was in 2003. 20,000 miners have died from black lung since I gave that testimony. So we haven't done much of anything. We didn't even have a rule about silica until a few weeks ago. So the answer to that is not a lot.
Next questions will be for Dr. Harris and Shafrick. When it comes to individual miners, do all seem to be affected in the same way, or does it vary by miner? In other words, if you're in a mine that's got poor ventilation, hadn't done anything about it, is everyone there generally going to come up with some issue, or is it different among miners?
I think it's a complicated answer. It depends. I think I have miners who mine for 4 decades in low coal underground and never got black lung. And so it sort of depends on what your body does to the dust it inhales. And so you have an immune system that can kick out dust more effectively in some people than others. And I think I don't think we know enough to say who individually is at risk, but we do know risk factors of where they're working and what kind of coal they're mining and what their specific job tasks are. The closer you are to the seams, the more rock you're mining, the more dust exposure cumulatively over time, the higher risk you are, but I don't think individual risk factors we have totally sorted out yet.
Dr. Shafrick.
Yes, Senator, I'm an engineering, mining engineer, so I'll yield to the medical discussion of that. But I would also agree that it would most likely have a lot to do with what their specific job was, what they were doing, how much rock was being cut at the time that they were working downwind from it, and what dust mitigation technologies of the many that are available were being deployed at that site, and if that site decided that they needed those or was told that they need those. There's a huge number of variables here to be able to answer that question fully. So I'd be more than happy to answer it in more detail for you if you had some specific case that you were looking for.
My simple observation would be, since there's variability among miners, and Mr. Roberts said it's inherently kind of dangerous in some places, is that early detection would seem to be the only way that you can kind of, in a fairly simple, broad way, make sure you're getting at it before it becomes incurable. So I think that's where a lot of attention and focus would need to be placed.
Well, I wouldn't disagree with that, but I would point out that if you are mining rock along with the coal, you're creating coal dust and you're creating rock dust, and that rock dust mixed with the coal dust is deadly.
So that'd be the best prevention, is to make sure you filter that all out in the first place.
If you could, but I just point out there's quite frankly not been a great deal of effort put into that until this silica rule was promulgated. That's the only step that I've seen in the many years that we've been raising this here in Congress.
Thank you.
Yeah, and as probably one of the only former geologists in the room, it's interesting if you look at the sedimentary environments by which sedimentary rocks get created. You generally have shoreline features that have clay, and sandstone, silica, coming down little critical particles of quartz that is sand, and then it gets mixed into embayments where you have lots of lagoons and swamps, where you have a lot of carbon, the leaves from trees, and all that detritus comes in, and that becomes coal. And then the clay and the sand they kind of feather into each other, and in certain places where it's dropping rapidly, you get huge, thick packages of coal. Other places you'll get beaches. You can see deserts become solidified big, thick packages of rock. What's critical here is the fact that where miners can make money best is where you have those thick packages of what becomes coal, of all that organic material, and not much of the silica. But there's always some silica in there. In other words, there's an inner fingering of region. I think what Dr. Harris was describing was or actually I think Mr. Roberts was describing that the easy stuff is gone, and so now you're getting thinner packages of the coal itself, and even that coal that you get is going to have some silica in it. So it's obviously a problem that's not going to go away. It's not going to get better. Senator Casey?
Mr. Chairman, thanks so much, and appreciate you having this hearing along with the ranking member. I want to welcome and thank our guests for their testimony and the experience they bring to bear on these subjects. And in particular, I want to thank President Roberts for his work, his toil, and dare I say sweat on behalf of miners, coal miners all these years. I wanted to start just with a little background. I grew up and still live in Scranton, Pennsylvania, which for a while was the anthracite capital of the world, or pretty close to it, so-called hard coal. And for a while there, virtually every family had a coal miner, or more than one, generation after generation. I've had, since my family emigrated from Ireland, three generations of coal miners, and then the fourth generation was my grandfather, Alphonsus L. Casey. I want to just say his name in the hearing record. He was a coal miner as a kid, really, from the age of 11 to 15 or 16, about 5 years from 1905 to 1910. And he was in the mines right around the time that Stephen Crane, the great novelist, Red Badge of Courage. He was dead at the age of 28, but he wrote an essay about a mine near Scranton, and he described it in the most haunting and horrific way that only a coal miner would understand. At one point, Crane wrote in the essay that before us stretched an inscrutable darkness, a soundless place of tangible loneliness. And then he went on to describe all the ways someone could die in a mine. So it's a haunting portrayal, but obviously accurate for the late, I guess around the 1890s when he wrote it. And obviously we've made some good progress over the generation since then, but this problem is still with us. The black lung and the horrors that some families have experienced, some miners have. And Dr. Harris, I was noting in your testimony about the reality here of what this means, the debilitating nature of these cases, and how painful they are when someone is experiencing black lung. In your experience, do miners with the most serious black lung disease always get the benefits they've earned? That's kind of part one of the question, and part two is what stands in their way.
Thanks for that question. The short answer is no, they don't always get the benefits they deserve. And I think it's important to understand how long and painful the process is for the miners. And the average case takes years to resolve. And the layers of appeal that happens goes on, from the Department of Labor to the administrative law judge, to the benefits review board, to the district court. It just goes on and on and on. And it's super frustrating for people. I think the biggest reason why claims are disputed is whether or not complicated disease is there, whether or not progressive massive fibrosis is present or not, which is usually one X-ray opinion versus another X-ray opinion. And so I think an important way to improve that process is to utilize CT scans. And so inside the Black Lung Benefits Improvement Act, it specifies if someone's X-ray is abnormal, we should be using CT scans. And I think that would help tremendously to improve the process. It's not going to help every miner. And I could name a million examples, not a million, I could name many examples of miners that I've cared for that have really horrible, horrendously severe disease, category B progressive massive fibrosis. Last week I was working on a case, and his case has gone on for 5 years. He has a mass that's 5 centimeters in his lung. It's not subtle, and it's still taking 5 years to resolve. And I think it eventually will resolve in his favor because the evidence is indisputable, but it's taking a really long time, and so there's lots of challenges.
And I think there are a few diseases where literally every breath you take, you can feel it. And obviously, one of the many reasons why we have to pass the Black Lung Benefits Improvement Act and to close loopholes, because if we pass that law to close loopholes and order courts to award benefits. I wanted to conclude, and maybe I'll submit this for the record, but President Roberts, you talked about the silica rule, and we're grateful for that, for the work on that. And maybe I'll just, I don't know if we have time for a question over. What's the most important thing we could do here in the Senate and the House to ensure that coal miners affected by black lung disease can easily access the disability benefits to which they're entitled?
Well, first of all, the system is grossly unfair. And what the doctor said here has been our experience too. And I think you should take a look at some of the things that's happened along the way here. We've had attorneys that withheld evidence that miners had pneumoconiosis, and they did not inform the opposing attorney that they had that. Those people have been sanctioned. Then just go over to Johns Hopkins Hospital. There was I think CBS did a story on this. They had a doctor there that was well known that never one time in his career found pneumoconiosis in a miner's lungs. And every time that he made a decision like that, the miner did not get their benefits. So there's got to be some way to level the playing field. I would suggest just ask any attorney in the coal fields if they want to be a black lung attorney and see what they tell you. They can't afford to be a black lung attorney. So workers who are sick find themselves without representation or depending on a lawyer attorney that just wants to be helpful to society. And there are some of those out there, and I know them. But if you want to make a living as an attorney, you don't want to be doing this. So we've got to figure out how we balance the playing field here. But the most important thing we could do, let's not have anybody else contract black lung. Mm-hmm. And if you think that can't be done, that's not true. We heard for years that you couldn't make coal mines safe, but we proved with the law that was passed in '69 that you could. Just look at the statistics of the 20 years, 10 years, 30 years, or 40 years before the law passed and see what's happened the 40 years afterwards. There are people walking around alive today would have been dead in 1970 if they didn't have this law to fall back on. So laws work, but you got to have laws that are enforced, and people have to want to make those mines safer. So let's just not have any more black lung cases. And Congress has the power and the ability to do that. That's a fact.
Thank you.
Thank you. Senator Lujan.
Thank you, Mr. Chairman, and thank you very much for having this important hearing. I very much appreciate in your opening remarks the inclusion of your statement with the Radiation Exposure Compensation Act as well. Thank you very much for that. To all of our panelists, I want to thank you for being here today. As I begin, I want to be abundantly clear that I am fully supportive of working with my colleagues to improve all of the environment associated with exposure to uranium, to coal mine workers. There must be more that we can do, whether it's adoption of technology, it's looking to make sure people have those that can best represent them given all that's going on, and families deserve to heal for those that are still fighting cancer. Now, what I want to use my time today is to bring some attention to uranium mine workers as well. New Mexico uranium mine workers who worked beyond 1971 have faced a huge injustice. They have no access to any programs in the United States, even though Congress took action with the leadership of Orrin Hatch once upon a time to provide protection to uranium mine workers through 1971. The Radiation Exposure Compensation Act, enacted in 1990, expanded in 2000, left out post-71 uranium mine workers in New Mexico, Colorado, Arizona, Wyoming, North Dakota, South Dakota, Washington, Utah, Idaho, Oregon, and Texas. Due to their work and exposure to radioactive uranium in the name of national security, mine workers are now struggling and dying of lung cancer, lung and pulmonary fibrosis, and other conditions. The U.S. government has left them to fend for themselves. It created the uranium mining industry, But when the government stopped being the sole purchaser of uranium ore after 1971, it left workers excluded from RECA, even though they were working alongside eligible workers. Now, Dr. Harris, yes or no, is uranium ore exposure in 1971 associated with lung cancer, lung and pulmonary fibrosis, silicosis, pneumoconiosis, and renal cancer?
Yes.
Is uranium ore exposure in 1972 associated with lung cancer, lung and pulmonary fibrosis, silicosis, pneumoconiosis, I'm pronouncing it incorrectly, and renal cancer?
Yes, and I can tell you that because Dr. Akshay Saud, who's one of my mentors, did a study to answer that question and looked specifically at lung disease before and after December 31st, 1971, and found there's still exceedingly high amounts of chronic lung disease after the 1972 cutoff, which is a bit arbitrary.
Is that consistent in 1990?
Yeah, I don't know any data to suggest that anything has improved dramatically in that time period.
And to my colleagues, even though we have the evidence, RECA excluded those who were exposed after 1971 and experiencing the ever-deepening damage of government-sanctioned uranium mining. Cipriano Lucero, who is from Grants, New Mexico, he began working in the uranium mines back in April of '77. Now, this is a quote from Mr. Lucero. He said, "The lunchroom where we ate, lunch was covered in a fine layer of the yellow cake, as well as that was the only place we had to sit and eat. No matter how many times we wiped it down, the table and chairs were always covered in the fine yellow cake." That's the place that they designated for them to have a bite, which was supposed to be one of the cleaner places. He suffered from pulmonary fibrosis, sleep apnea, high blood pressure, cognitive heart failure, kidney failure, arthritis, and diabetes. He sadly died in 2020 at the age of 66. Now, Mr. Lucero died without his sacrifice recognized or compensated by the United States government. I have endless stories of constituents, not just from New Mexico, from through different parts of America. And I certainly hope that we can find a way to take action. And to every one of my colleagues in the United States Senate that voted yes to advance the Radiation Exposure Compensation Act amendments to be part of the NDAA, and those of you who voted yes to advance it as a standalone bill, working with Senator Josh Hawley, where we had 69 senators show up and say, yes, we can do better. It's now before the U.S. House of Representatives. This program expires on June 7th of this year. All that we need is a vote from Speaker Johnson. I'm confident that we have the votes to get this done there. And I just appreciate my colleagues giving me another opportunity to raise this issue. Now, to this hearing, Mr. Chairman, you can count on my support to stand side by side with colleagues who are fighting on behalf of uranium, of coal mine workers and their families, and to make all of these environments safer. So I look forward to learning more from families all across America and through New Mexico to make sure I'm doing my part. And I continually pray for your health and for your wellness. And I hope that you'll consider lifting your prayers up as well for those families that we're fighting for within the Radiation Exposure Compensation Act as well. Thank you, Mr. Chairman.
Thank you, Senator Lujan. Why don't I let you ask your question, and I'll ask my questions?
I think it's been a good conversation in terms of understanding what we're up against. I want to ask this of Ms. Brown-Barnes. When it comes to the entity that financially should be in good shape to handle this, and we're in an industry where we know has taken a lot of heat for many other reasons that's put it in financial distress, how does this all work itself out, in your opinion, in the long run, when you have a trust fund that's being underfunded and you've got liabilities that are increasing? How does that all work out, and at what point would potential future liabilities make it impossible to dig out of the hole we're in?
Well, there isn't likely one solution. Congress could forgive some of the interest in the debt in terms of the borrowing that's been going on since 1979. There's also the coal tax But one thing that the Department of Labor has projected is the coal tax is enough, at least for this fiscal year, to be able to meet the benefit liabilities as well as the administrative costs of administering the program, but it's the debt servicing cost part of it that is still something that needs to be worked out. In terms of overseeing the program, the Department of Labor itself has to have some sustained focus and leadership attention to looking at this, to overseeing the coal mine operators, especially with regard to self-insurance, and making sure that they have the necessary collateral to be able to cover not just the current benefits, but also the future benefits.
So when you describe the fact that the debt service is overwhelming, of course, debt comes from running annual deficits. It's a cumulative result of that. Our own federal government is doing that now to the tune of almost 30 cents on every dollar we spend. I'm on the budget committee. You talk about a distressing subject being there, and we're trying to figure out what to do there to make this place fund itself better. And this is the backstop for this trust fund. So there's a lot there that looks like it's in peril. What have those annual deficits been as a percentage of what it should be to actually avoid the deficits in the first place? In other words, how much are we missing the mark on the average, say percentage-wise? And did we start this back in '79 when it was annually in running deficits to where it wasn't funding? We weren't paying enough into the fund to pay the benefits?
It did start back in '79 when we were doing the borrowing, from the Treasury, from the actual general
That's when
fund.
you had the shortfall, and has it been every year since then?
It's been just about every year. Congress did forgive some debt in 2008. It was about $6.5 billion. That did help some. The coal tax has had some decreases and increases, and so that's changed over the years as well.
And that's likely to be less, just looking at where the coal industry is going in general. So what is the total debt currently held by the Disability Trust Fund?
Well, I know in terms of, at least speaking to the borrowings, in 2023, there was $2.7 billion that had to be borrowed.
That was the annual deficit that year?
That's how much they had to borrow to even cover all of the expenses, including the benefit payments and administrative costs.
Mr. Roberts,
It's $6.4 billion.
in total, the debt that
Total.
the
Yes,
trust
I
fund
think
has?
so, yeah.
Okay. So it looks like with an industry that's shrinking and maybe now new liabilities that are arising, it has no way to currently pay for the benefits that need to come from it. And the federal government is borrowing 30 cents on every dollar. We've got a predicament there, and it's probably an issue more broad than just this conversation. So that ought to make us all take pause on what we do to eventually solve this problem.
Rather sober. The entire discussion is rather sober. Dr. Shafrick, the U.S. is on track to create thousands of new mining jobs in the future. There will be millions of new mining jobs worldwide as we transition to different energy systems, more electric vehicles. This great transition is going to move in various directions, but they're all going to require more materials. And we need to respond to health and safety best practices that are responsive to this growth. And as we work to explore best practices, what lessons do you think we can learn from our international partners? I know Australia is a good example, but where's some places we can make sure that our mines are as safe as they possibly can be?
Yeah, Senator, thank you. One of the issues that we have in the United States is that we have several different regulatory environments around workers, and MSHA has their own set of regulations, and OSHA has their set. Now, this makes sense from a variety of points of view, but it does cause issues when we are trying to both export and import safety technology into the United States. because a technology, and we experienced this quite a bit in the communication tracking field, technology that was perfectly acceptable in, say, Europe or in Australia was not acceptable for use in the United States. Now, a lot of these get into details very, very quickly. So I would just suffice it to say for the higher level view is that I think that we need to do a look at a lot of the regulatory procedures, and I know that MSHA's not necessarily happy with those either. So I think that we should look at these things and in a detail and in particular sections of the regulations and say, where are we building an impediment where we should be building an incentive?
Yep. Yeah, thank you. I think that's true. Ms. Brown-Barnes, you've contributed to a number of studies about the federal benefits program. You know, what lessons do you learn from our history in administering the Black Lung Benefits Program that we can apply to other existing or future workers' compensation programs?
And some of the key practices or leading principles that we use when we're looking at other benefit programs is the leadership focus and sustained attention on managing the program. We also look at goals and performance outcomes and having some key measures. It's also important to look at the data, have some reliable data that you're analyzing and some hard evidence there. We also look at the involvement of the key stakeholders, the employees, those who are having those experiences that you can talk to and learn from as well. So just to name a few of the practices.
All right, I appreciate that. Thank you. President Roberts, you've obviously had a long history in the mining industry, not just as a miner yourself, but as someone who's been supporting miners and making sure they get the benefits and the health care that they need and deserve. And you've seen firsthand the benefits of previous mining health and safety improvements. The 2009 dust rule, everyone's referred to. And you've in many ways been at the helm of addressing the efforts to pass remediation for black lung to make sure that the Black Lung Benefits Improvement Act delivers. How would you approach, and again, we're going to need miners not just in coal, but in all different levels. How would you approach encouraging a new generation of miners to join the workforce, and how do we best support them?
I don't believe, at least at this time, that we have a shortage of people willing to work in mining, particularly if it's not coal mining. We have people who are applying every day to be in a coal mine, right? So we know that people are hungry for employment. And quite frankly, a coal miner working under a UMWA contract can easily make $100,000 a year. So if we make those jobs safer and healthier, then we'll have plenty of people wanting those jobs. But I think we're talking about the future here of different kinds of mining. I think what we need to do is the opposite of what we did with respect to coal mining. We never worried, when I say we, I'm talking about the government itself, and all of us are part of the government one way or the other. We never worried about, we need safety laws here, we need laws to protect people's health, we need laws to protect them from being killed, covered up, blown up, burned up, and all that happens and has happened in the coal industry. We need to look at that in the beginning, not at the end, which we seem to be doing with respect to coal mining.
Right. Well, that's a good point. Dr. Harris, in Colorado, we've got a long history of not just coal mining, but uranium mining as well. We're the proud home to hospital, National Jewish Health, which is the only HRSA-funded black lung clinic in our state. And it also does radiation screening for former uranium miners. As you've described, accessing timely screenings is a vital part of disease prevention and management. It helps miners, A, get the support they need quickly, but also it's proves their eligibility for black lung benefits. What would you say, or what would you describe as specific steps that we should take to make sure that the timely information and medical services can reach miners across the nation?
I think mining often happens in rural communities, and access in rural communities is challenging in general. And I think the key is having local, regional people that are experts. And I think for industries like uranium, there are very few people who are experts in how to take care of someone with uranium issues related that cause health issues. Similar for black lung. I did my fellowship training in Connecticut. I never once saw a coal miner until I moved to Virginia. And so a lot of this is regional problems, and we have to come up with ways to have regional solutions. And so I think the RECEP clinics that do the uranium screening should be expanded. And they're going to get cut off when the RECA benefits expire, because those are who's eligible to be seen in those RECEP clinics. And so I think building on the expertise that already exists for those clinics is critical. And I also think coming up with more innovative ways to bring care to rural areas is important. And so we can learn from programs like the Coal Workers Health Surveillance Program, which has a mobile unit that does mobile x-rays and mobile screening. There's a program like that at the University of New Mexico. I think we have the technology to do these things and to be able to take digital x-rays and to bring the care locally to people. And the last point I'll make is, I work in Central Appalachia. It's really hard to recruit doctors there. It's just hard. And most of our new hires for providers are nurse practitioners or physician assistants. And so I think those folks are often coming from the communities where they're serving, and to build some expertise into the nurse practitioner PA capacity locally is going to be key for the future.
Good points, each one of them. Appreciate that. I don't know if anybody has anything last unsaid that's boiling over before I close the hearing. I suspected Mr. Roberts might have a comment.
This would be just one quick point. We've focused on the most severe cases of pneumoconiosis here, but we should not leave here thinking that coal dust doesn't kill coal miners. It just takes a longer time for a miner to die. And once again, the ability to receive benefits in this program is so unjustly, it's not administered unjustly, it's just unfair. Because a coal miner who is sick and can't work is trying to get benefits against an attorney that's making $400,000 a year, and they have access to doctors from all over the United States. And that coal miner doesn't have that. It's not a level playing field, folks.
Yeah. Dr. Schaffer, were you going to say something?
Yeah, Senator, I just wanted to point out, because it's an important thing to keep in mind with the new silica rule, is that it applies to all miners. That is not a underground coal, surface coal only. That is all miners, and there are miners everywhere in the United States. The vast majority of mines in the United States are surface mines. The vast majority of mines in the United States are not coal mines. So when we're considering a lot of these issues, I think that we need to consider that it does impact the industry as a whole. It doesn't just impact the underground coal miner.
I couldn't agree more, and I think that's a longer discussion even as you look at how many smaller mines there are and how difficult it is to get their not just their efficiency, but their health, safety and precautionary methods in place. Thank you all for not just being here, but for your service in your lifetimes. One of the saddest songs I know is called "Dark as a Dungeon," where it says, the end of the song says, "Where the rain never falls and the sun never shines, where it's dark as a dungeon way down in the mine." And it is a challenge that I think we all share, and that I think that we can successfully address. But it's going to take persistence and commitment from us in the Senate. But again, appreciate all the commitment that you guys have displayed. That's going to end our hearing today. I would like to thank each of the senators who came and joined us. I'd like to recognize and thank my Vice Chair, Senator Braun, for his efforts. I want to thank each of our witnesses, Ms. Brown-Barnes, Dr. Harris, Mr. Roberts, Dr. Shafrick, for your participation. For any other senators who couldn't get here or watching from their office, if any senator wants to ask a question or an additional question, just questions for the record will be due in 10 business days, June 5th at 5:00 p.m. The committee now stands adjourned.